Good afternoon. My name is Jason Holcomb, and I am the Director of Community Impact for Region 1 Planning Council. And today I would like to share with you some of the results of a report that we did in partnership with Alignment Rockford around their Ready to Learn initiative. If you have not already read the report, please pause the video, go to Alignment Rockford's website, find their Ready to Learn initiative, and download the full report. I am going to make this presentation with the assumption that you've read the report already, so I will not be going into all of the background information. So please read the report and come back and watch the video. Now that you've read the report, you understand what the EDI, the Early Developmental Instrument, is, and understand that Wave 1 was the first round of this data collection for the Rockford region back in 2019. And that was done over the Rockford Public School district boundaries, but included private and public schools. And you'll see the demographics from that Wave 1 data here as compared to the national cohort. Something to note about the national cohort is that it's heavily based in California and a number of communities that have higher Hispanic or Latino populations. So that's why you're seeing a big difference in that demographic data from the Rockford region to the national cohort. And also in the English language learners, there's a much higher percentage, as you'll note, for the national cohort, while Rockford region does experience a higher percentage of IEPs for students needing special education assistance. When you look at the Wave 2 data, which also was expanded to include the Harlem school district boundaries, but again, including private and public schools for the Rockford Public School and Harlem Public School district boundaries, you'll see that there was a slight change in the demographics for the Rockford community with a higher percentage of white students and a almost correspondingly lower percentage of African American or Black students being surveyed in the second wave of data, which was collected in 2022. The national cohort stays relatively similar, but you can see the differences between Rockford and national once again. When we compare Wave 1 to Wave 2 data in aggregate, so basically for the entire community, not breaking it out into neighborhoods or schools, but just as a whole, we see that the change from Wave 1 to Wave 2, there are changes, but it's not large changes. It's a percentage up here, a percentage down there. When we compare that to the national cohort, we actually see that Rockford community did pretty well and in many cases outperformed the national cohort with increased percentage of number of students on track and decreased vulnerabilities or at risk. One of the exceptions to this was in the area of social competence, the developmental domain of social competence, in which Rockford saw an increased number of students with vulnerabilities, whereas the national cohort saw increased number of students on track, the percentage of students on track. When we break the data out a little bit and disaggregate it into neighborhoods for the Rockford area, we see that there's change, but it's not major change in every area. So here where you see the darker green or the darker red, those are the areas where the changes are more critical or statistically significant. And when we look at it that way, again, while the aggregate data didn't show a lot of critical difference, here we see that at a neighborhood level, there are more critical increases in vulnerabilities, neighborhoods experiencing increased vulnerability, than there are neighborhoods that have a critical decrease. So that's something we want to pay really close attention to and try to better understand. So that's really the essence of what this report was about. How do we try to better understand for the neighborhoods that had critical changes, what was their experience between Wave 1 and Wave 2, or the families living in those neighborhoods, that might help us better understand what's impacting some of these changes. And so one way to do that is look at other community data sets like a neighborhood equity index. And so here we're looking at the degree to which neighborhoods had equity challenges. That's on your bottom axis going across the bottom, 0 to 8, and then comparing that with the increases in vulnerability by neighborhood. What we see here is that neighborhoods that had more equity challenges also saw an increased number of vulnerabilities in the developmental health domains. So we would say, as it relates to the Rockford community, having an equity challenge in the neighborhood is going to create more likelihood for there to be higher vulnerabilities for young children. When we look here at the relationship between household income and vulnerabilities, we see the opposite relationship, because here we see that income is going from low to high. And so the relationship is negative, meaning the lower the income, the higher the developmental vulnerabilities are, and the higher the income, the lower the developmental vulnerabilities are. And lastly, we took a look at the relationship between domestic violence at a neighborhood level. So looking at the percentage of domestic violence per 10,000 people and ranking that from neighborhoods experiencing less to neighborhoods experiencing higher rates of domestic violence, and then compare that with the percentage of vulnerabilities. And again, this is a positive corresponding relationship, meaning that more domestic violence incidents in a neighborhood equates to higher rates of vulnerability for developmental health for young children. So that's one way to help us better understand what's happening in our community. And the other way is to hear from parents and caregivers who are actually have young children, and to understand what has been their experience, particularly what was their experience between wave 1 and wave 2. And if you think about that time period, 2019 to 2022, that really corresponds with the height of the COVID pandemic. And so that's another contextual piece of information to think about as we understand the caregiver experience between wave 1 and wave 2. So we conducted a survey that had 9 questions, ranging from questions about employment changes to services that families were utilizing. And this survey was shared through Alignment Rockford and a number of community partners that participate in the Ready to Learn initiative. And we received a really strong number of 149 validated responses. And so think about that for a community of our size, that this was targeted specifically towards caregivers that had young children during that period of time, 2019 to 2022. So 149 validated surveys is a very strong, and I would even dare to say a representative sample. And the survey was administered both in English and Spanish, and we did have 14 completions of that Spanish language survey. Same questions for both, though, so all of that data is aggregated together as I go through and show you the results. So one question we need to understand, especially when we're looking at this at a neighborhood level and trying to understand why did things change in some neighborhoods? Well, did the people change? Well, on the whole, we only saw that less than 20% of caregiver families moved to a different neighborhood during this period of time. So on the whole, most of what we're seeing is not due to transients or families moving. Most of it is change that's happening within the neighborhood. When we ask caregivers, did you have a change in job status during the pandemic? Here we see that there was a lot of, so we look at workers with fewer hours, workers who worked fewer hours, those who began working remotely, those who were laid off from their job, and those who quit their job. We see that those 4 categories add up to about 50% of the total here. And so what that means is about half of the caregivers either reduced their hours, worked from home, or stopped working altogether. So those are pretty major changes as you think about a family system and a family dynamic of how that would impact the young children in the household. When we look at changes in services, meaning did you gain access to a service or did you lose access to a service? We see that on the whole, there was a lot more gain in access to services. And in particular, SNAP benefits, so that assistance with food, getting food pantries, utilization of food pantries, and Medicaid, state health insurance. We saw significant increases in those three categories for gaining services without much loss of access to those three. When we look at local parks, libraries, and health and wellness centers, you see it's a little more balanced where there's some who are gaining, some families gaining access, and some families that are losing access to those services almost in a balanced way. When we look at families' access or utilization of early childhood programs, we see that about 40% remained the same, or about 1/3, roughly 1/3, a little more than 1/3, while about 2/3 had some change. And those changes mostly were a reduction in utilization. So either attending fewer hours, making a choice to stay at home, or that a program closed. So about 2/3 saw less utilization of early childhood programs. And so unsurprisingly, as we look at overall early childhood program attendance, we see that more than 40% of families during this period of time did not attend a program. And then that was followed by the highest utilization being for state pre-kindergarten, kindergarten, child care at a home environment, and then Head Start. And these are not mutually exclusive categories. So a family can select that they were utilizing kindergarten and Head Start, namely because they might have more than one child. And so how does all of this changing dynamics, whether it's employment, whether it's utilization of services, how did that affect behavior? So first, we're looking at caregivers' behavior and asking the caregiver, how did your behavior change as it related to yourself, as it related to how you interact with your family or take care of yourself? And what we saw here is that you can kind of follow the shading patterns where darker is a little bit higher in each category. So when we look at staying connected to friends or family and having time to take care of yourself, we see a slight shading pattern for less often. So those activities were happening slightly less for caregivers. Playing with your children or reading books with your children was slightly more often. Having access to healthy foods was somewhat balanced, if anything, a little bit skewed more towards more often, because you see 15 responses for much more often and only one response for much less often. Getting enough moderate physical activity per week, we see that that was less often for caregivers. And getting enough sleep per night was somewhat balanced with a little bit of shading towards the less often. So that's caregiver behavior. How did that translate within the family unit to the children's behavior? So here we ask caregivers the same thing, but ask them, okay, but what about for your kids? How did this translate to your child's behavior? And here we see same type of setup. So the shading patterns are going to indicate a higher percentage either to the left or the right. Assistance with household tasks went up. Kids doing more chores. Parents maybe are home telling, hey, you got to get engaged and helping out. More children expressing their feelings. So think about that developmental health domain of emotional maturity and how that might relate to this period of time of expressing emotions. Less engagement with playing with other family members or neighbors outside of the house. Reading books with or without a family member more often, strongly more often. Having access to healthy foods, somewhat balanced, but again, skewed a little bit more to the more often category. Again, think about some of those additional services that were accessed during the COVID period of time, SNAP benefits, food pantries. Higher access to healthy foods is what we see here in aggregate. Getting daily or physical activity, unfortunately, this one is somewhat significantly less often. And getting enough sleep, we see this one pretty balanced. If anything, there's a little bit of shading towards the more often category. So once again, I just hope this was a helpful supplement to your reading your report. Hope you can really dig into the data and maybe come up with some of your own follow-up questions or your own insights into what this period of time might have looked like for you and your family and how that might impact these overall community outcomes. One thing I would encourage you to do, because we know this work is so critical for our community, is again, go on that Alignment Rockford website, find their Ready to Learn initiative. There are opportunities to volunteer so you can plug in and support this work in our community. Thank you.